We're here today at the American Operating Room Nurses, AORN, Global Surgical Conference and Expo in Nashville, Tennessee, the Music City. This is in the USA. This is part of our series, the AusMed Education series, on reaching out to nurses across the sea. Today we have Dr. Joni Brady, who is the chair of the Board of Directors of the International Collaboration for Peri-Anesthesia Nurses, otherwise known as ICPAN. Welcome, Joni, and I must say, don't we just look like cougars sitting here with our...
Yes, we are, two cougars.
So, Joni, I have a few questions for you. What we're trying to do is really probe into what you do. So let me ask you the first question. Tell us a little bit about your background and what you do as chair of ICPAN, the International Collaboration for Peri-Anesthesia Nurses.
Well, thank you so much for having me today. It's a pleasure to be here and to meet you here in the Music City. I was born in New York and I have a Canadian half family, so I spent my childhood both in New York and in Montreal with my Canadian family. I graduated with a diploma initially from a nursing program in Syracuse, New York. And I'm a lifelong learner, so I've gone on over the years to get my doctor of nursing practice just a couple of years ago, and then putting that to great use now. I've been a past editor and officer for the American Society of Peri-Anesthesia Nurses and a military spouse, so I'm a global citizen as we've moved many times, and I've spent 11 years living abroad in Asia and Europe, so have an appreciation for a global life and a global world. And in Europe, during the 2000s, that was really the genesis of our organization, the International Collaboration. And we did that by just meeting each other at various conferences in different countries and thought it might be nice to actually create a collaborative environment where we could impact practice on a broad level. So, as the chair, I'm leading our organizational development. We incorporated as a not-for-profit organization in the United States in 2015, and I chaired a transitional board for 2 years, and we now have our first elected board, which includes members from Australia, Denmark, Canada, Greece, and the United States. So we have a really great group of people to bring knowledge to the fore and advance the cause of nursing.
Well, that sounds incredibly innovative, and it's really refreshing to hear this development of new ideas and new groups and new collaborations. So, Joni, what's the mission of the organisation of ICPAN?
So our mission is to facilitate international nurse networking, to encourage some collaborative research and evidence-based practice implementation, and to advance peri-anesthesia nursing's expertise, voice, and participation in global safe surgery initiatives. So we have several initiatives happening globally to improve the lives of 6 million people that die each year in surgery. It's hard to get your head around that, but having been abroad in countries that have low resource, low income, minimal to no income, there is no infrastructure to support. So we are really trying to embrace knowledge in those countries, to bring knowledge to those countries, to care for everyone who has the right to safety and dignity in their health care. Unfortunately, in industrialized nations, we don't often understand no-resource environments, and yet surgery is happening in those environments. So we hope to really empower the nurse, provide some training and education where there is none, and bring safety to people everywhere.
So once again, we see that nursing is at the forefront of advocating for patients. And this is really an important part of the nursing role, isn't it? No matter what area we're working in, always the patient is what it's all about. And it's very refreshing to hear you say that.
Thank you.
So in terms of global trends, I'm very interested in your thoughts on how you think the whole trends of peri-anesthesia nursing are moving. And even OR nursing is moving across the world from what you're seeing.
Well, I think the biggest trend that we're seeing is the implementation of enhanced recovery protocols across the perioperative spectrum, which really is being led, or to a great extent was led in Denmark with their initial work around enhanced recovery, the surgeon Henrik Kellett. And also in the UK, they have had the Perioperative Medicine Initiative, which launched around 2004. And they're really seeing that team-based care, that having the right person at the right time in the right place in terms of the professional on the care team is doing the work to really empower the patient to make the best decisions. There's a movement towards shared decision-making. Previously, if a surgeon told a patient, you need this surgery, the patient would say, sure. And no matter what comorbidities he or she had, the surgery would progress. Now think about that. You have someone with hyperglycemia, obesity, low mobility. They're going in for a total joint replacement. The focus now is to pre-optimize them. And the nurse has a great role in that in terms of being the educator and coach of the patient. So instead of taking a sick patient or a compromised patient and doing an elective surgery, you would have shared decision-making with the patient to empower him or her to do some healthy things, to get the glycemic control in control, and to have a better outcome. So that shared decision piece, I think, is the big trend that we really need to embrace as nurses, because we are the educators, we are the front line with that patient through every phase of the perioperative spectrum. So we have a big role in that patient empowerment.
And it's very, very refreshing to hear that we can understand now how absolutely important the role of the nurse is in actually being there for the patient at these critical times across the life continuum. Yes. And in this case, it's perioperative care. Yes. The next question I'd like to ask you is, what do you think is the biggest challenge currently for nurses in the area of peri-anesthesia?
I would say our biggest challenge is there are wide gaps in the research literature to guide our practice. You can look at so many elements of our practice, and we've done things because we've always done it that way. But we're in a time where the nurse profession is progressing to high-level research, but there's not enough. So most of our practice standards that we observe right now are at a lower level of evidence, expert opinion, or some quality type studies. We really need robust research in many areas across the perioperative spectrum. In theater in particular, there's a very big gap. But in our peri-anesthetic field as well, and we're a continuum, so we should be doing some research together as colleagues across that, and I think that's our mission. We really need to advance the science. The other thing is, in countries that don't have safe surgery, there's no guarantee that a patient and family are going to have the outcome they wish for or deserve. And I think in poorer nations, nursing is still not respected culturally, so we need to advance that level of respect as well.
It's very interesting because we all know that holding someone's hand at a time of vulnerability can be just as powerful as some medications, if not more. And that human contact is so important.
Yes.
And obviously in operating theatres, or in the peri-anesthesia area, although a person is for quite some period unconscious, you still cannot take that nursing contact away from the patient at that time. Thank you. That's a great insight. What's the most interesting research or you've recently read or heard?
So right here at the AORN Expo, I attended a class yesterday that was given by Dr. Valerie Hooper and Dr. Doreen Wagner, and it was a large study across the southeastern health system, but they were looking at the impact of intraoperative hypothermia on postoperative delirium. There's been a lot of emphasis around postoperative delirium recently because it's been so overlooked for so many years, and anesthetics produce that outcome. So they found, interestingly, that intraoperative hypothermia is protective in the oldest of the old, in the elderly. and less so in the younger population. It's sort of counterintuitive, right? You would think, oh, the elderly have so many more challenges, yet we're seeing it in the younger population, and it's often being overlooked because they're young and healthy. But that doesn't mean they're not having delirium, and you have to really worry about that in terms of outcomes with day surgery and how quickly we're sending people home. So I thought that was so compelling, and it's the first of its kind, and they'll expand on it because it was a highly 90% Caucasian population, so not that generalizable, but so interesting that hypothermia could have that impact, or there could be a direct correlation between the two. And I would round on postoperative patients as a pain management nurse, early postoperative patients, and sometimes I would go in on post-op day one, and that person was not with us, very much showing signs of delirium, and yet the nursing team, the medical team, no one had really picked up on it. So sometimes the delirium is hidden in this silence, in a sense, and we need to do the proper screening and proper screening across the continuum in order to identify it and deal with it appropriately and advocate for the patient's safety.
That was obviously very fascinating insights, and what we might do is see if we can find the link to that lecture and put some information online for anyone who's listening to this to find out more information, because it's clearly very important. Now, for my next question, what would you say to a peri-anesthesia nurse listening to this interview right now?
I would say that nurses at all levels of practice are needed to drive quality. And whether you are a clinical nurse at the bedside, at the point of care, whether you're the manager of that nurse, the educator of that nurse, the researcher who's bringing evidence to put into practice, the doctor of nursing practice who's disseminating and doing implementation research, every nurse is needed to accomplish those goals. You don't need a doctoral degree to participate in a research study. You could be part of the intervention that is in the study. So I think we have to see ourselves in a broader sense. We all bring value at every level of practice, and we need to respect each other's level of practice as a team and as a profession to advance the profession.
Well, that's very sage words, and it's actually relevant to nurses no matter what area they're in, because we now know that the use of the word quality is bandied about everywhere. I might just ask you that. What do you think quality is? Because it's, it seems to be one of these terms that, may even be called a God term, that, it's just used, and once it's used, everyone sort of thinks, oh, that's good, we've got there, we've reached quality. What is quality?
Well, I think that's a really a big discussion to have. But many times what we, the professional, perceive as quality is very different from what our patient perceives as quality. And we talk about shared decision-making, and we talk about patient experience. This is the word, that's the little phrase, patient experience. Well, I think we have to really put ourselves in the patient's place to achieve their quality goals, which may be, in terms of determinants of health, a safe home to go to, transportation to get home. Those are things that are so vital to the patient, yet we're worried about surgical site infection and, the things that are in our world, some of the regulatory issues that we're beholden to. To me, quality is a combination of those things. There was a study that was done some time ago, and it was asking surgeons what their perception was of the success of a surgery. And they asked the patient the same thing, where the surgeons thought things had gone swimmingly because there were no complications and there was an early discharge and, done, the patient didn't feel the same way about it. Their priorities were very different than what the surgeons had priorities for. We need to listen to our patients, and I think nurses do that marvelously. Exactly. That's what we do. And so, to me, quality is bringing the evidence and the good outcomes to the patient's needs and expectations. And then we truly have patient experience. It's not just a phrase, it should be how we live every day in our practice with our patients, and let them make decisions based on their priorities and needs, but also really focusing on determinants of health, because we can do a fabulous surgery, but if the person is discharged from our care and there's no network, no safety net out there, no knowledge for them to tap into, is that quality? That post-operative space is a very unknown, unexplored area. We do have a researcher from Sweden, several researchers from Sweden in the peri-anesthesia realm who are really looking at that post-operative outcome space using technology and apps. That's a nurse-driven project. So I think quality needs to be combined in our perceptions as patients and providers, but also we need to be innovators in a space that is begging for knowledge.
And of course, a lot of the work that nurses do, and nurses are very much in that bridge between whatever's been the intervention is, and they're sometimes involved in the intervention, of course, and the outcome. But there is so much that nurses do that is not seen or not heard, and yet has a profound impact on the care, and that thread of compassion, that thread of advocacy, that thread of connectivity that nurses bring to their role is so important,
Yes.
and yet often so unseen.
Yes.
And it is very difficult to articulate because of its uniqueness. So thank you for bringing that part forward, because it is so important. And I think we as nurses have to be very careful with the use of the word quality, because it's such a vague term.
I do think that we have great potential to bring power in numbers in our field.
Yeah.
So the international collaboration is really about bringing practitioners together. We find similar struggles across practice, similar issues that we're dealing with patients, both clinically and socially. And so really to bring our voice together
it's very powerful.
as a profession is needed, because we have been a little silent.
Yeah.
I'm not the silent type, but
Yeah.
I think we need more of that in our profession to be seen and heard.
Yeah. When we look at the fact that next year is the World Health Organization's Year of the Nurse, this is no accident. It is actually demonstrating that nursing is really it's really timely for nurses now to really shout from the rooftops the value of the work that we all do. What's your comments on this? What would you shout out to peri-anesthesia nurses?
I would say, first of all, come to Cancun, Mexico.
Oh, I'm sure you'll have no problem.
In November of 2019 to attend our 5th International Conference. One of the things I am endeavoring to do, and am working with the Mexican Operating Room Nurses Association, some academics, some local hospitals, and their Student Nurses Association, to bring them together and have a big pre-conference education event for the Mexican nurses, and just invite them to come. There is no specialty for peri-anesthesia in their country, no specialized education. And in my conversations with the president of the Operating Room Nurses Association, Miguel Lopez, he indicated that they would like support and knowledge sharing. And that's a big aspect of our global group, is to do that knowledge sharing piece. So I would like to hopefully make it a Nursing Now event in Mexico. We're in conversations about that now, and I hope to confirm fairly soon. But I believe it's our time to really come together to show our value within the healthcare systems and within people's lives.
Yeah.
We're people as nurses. We deal with humans every day who have various challenges, various levels of wealth or poverty. We, as a profession, have the power to really harness our knowledge, strength, and passion for what we do, and disseminate and be known as the leaders in healthcare that we really are.
Yeah. So I have one final question. And this goes back to the beating heart of what you do. When it comes to safe surgery and preventing harm to patients, what do you believe are the key priorities?
Well, I'm the eternal optimist. I believe that our role and our goal is to ensure that every human on this earth has access to safe surgery, and a nurse that has the skills, basic skills and ability to give that care properly and safely, and really assist that person on their journey to health and recovery. We are currently doing a study through our international organization. Our great colleague, Dr. Karuna Dahlberg in Sweden, is leading the study. We're looking at a cross-sectional descriptive study of what is a PACU nurse. What does he or she need basically to perform in that role to ensure safety for a patient post-operatively? So we're mapping what is that nurse for places that don't have any identity for that nurse yet. And we've been collaborating with Dr. Jim Brown in Cameroon. We're actually scheduled to go down and teach. 3 of us, a nurse from Australia, a nurse from Denmark, and myself, but we had to cancel. And it was scheduled for January. It would be the second ever PACU course in that country. And they have civil and political unrest right now, and it was unsafe for us to travel there. I think about that. I think about us every day in our free world, getting up, driving to a hospital to have a procedure or surgical center, and going home. And you have countries where people are walking across dirt roads to come and try to access care. They have the ability to have the surgery and then hand off to an unskilled person. Those nurses need us to come in and give them the basic ability to manage those patients and ensure that everyone on earth is entitled to health and welfare, and our fastidious oversight as nurses, which we do.
I have one very, 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 very final question, and that is, what would you say to nurses entering the profession now about the future of nursing?
Well, you are the future of nursing, first of all, but I would say embrace it as a profession. Embrace your role as part of a complex team caring for that patient, but always keep the patient at the forefront. Think about your role in research and evidence generation. I do think one advantage we have is the nurses coming out of their basic programs now are getting research education on the basic level. So my hope and my goal for all nurses coming into the profession is to be loud about what you know. Don't stand back, because often your valuable input will make a difference in that patient's life, because you have the closest relationship with the patient typically. Now, arguably, let me add that. But I think that be the professional you are. Elevate the profession to where it deserves to be as an equal partner on a care team with a surgeon, with an anesthetist, with a physiotherapist. We together need to drive that care, but nurses need to own our space and be very forward-thinking, but also broadcast the importance of what we do. And we definitely need some implementation science research to show the value of nursing care. We've been remiss not to show nurse-sensitive outcomes in our research. Therefore, the nurse gets a little hidden in the picture. Yet what we do matters. Now we have to prove it with data and science to underpin our actions and be the leaders on that team that we are.
Yeah. Okay. Well, I would agree with you. We've got to prove it in the manner in which you say. But I also think we need to be much more vocal in the media, and certainly at grassroots level, and actually demonstrating our value and what we actually do, which is 24-hour care.
And we have to be perseverant.
Yeah.
To get into those spaces, into the political spaces, into the economic spaces that drive healthcare or stop healthcare. And I believe that that's a really important aspect of being loud
Yeah.
and being out there
Go.
and being part of it.
Yeah.
And to know that you're important.
Yeah.
Nurses are so
Vital.
important.
Vital.
So important. And we need to let everybody else know that. Interestingly, in the United States, there's a Gallup poll, and it polls the public on most trusted professions. Nursing has topped that poll for 17 years. Why aren't we louder?
Yeah. And we all know the importance of ethics in a highly technological world.
Absolutely.
Oh, well, thank you so much, Joni, for that wonderful interview. And we're certainly at a challenging time, but what an important time it is for the nursing profession. And boy, are we going places.
Thank you so much.
Thank you.
It's been wonderful.
Bye-bye.
Bye.